I'm Dr. J Hamelijnck, consultant psychiatrist working in the Great Yarmouth Recovery Team with a special interest of neurodevelopmental disorders. I have experience in the assessment and treatment of adults with ADHD. Next slide. In this presentation we'll be covering the epidemiology of ADHD and also a bit about what causes ADHD, with a special interest around emotions, and this is followed by the medical management. Next slide. The epidemiology of ADHD in adults is less than in childhood. Persistent rates are quite high. So in adulthood you would expect to be around 1 to 2% of people to continue to have significant ADHD symptoms. The prevalence in males is greater than in females, and this remains stable across the age range. You'll find more ADHD in specific populations like female prisons. Next slide. The persistence is very high. People with a diagnosis of ADHD in childhood can expect to continue to have significant symptoms of ADHD in adult life. Probably about half of people will only achieve partial remission. It seems that males may recover more than females. Next slide. The impact of ADHD on people's development of personality and other mental health problems is illustrated in this slide. As the child grows up, increasingly difficult behaviors emerge, like disruptive behavior, learning delays, and oppositional defiant disorder with challenging behaviors. In some people, this will lead to a classic picture of criminal behavior, exclusion from school, and development of a personality disorder. Next slide. It seems that in females the trajectory is slightly different, leading to much more mental health problems in adulthood. Females are on the whole less disruptive and less hyperactive, and develop more mental health problems like depression, self-harm, and anxiety. New slide. The concept of adult ADHD is fairly recent. In America, in Utah, they developed criteria to diagnose ADHD in adults. And it's interesting that in those criteria, emotion regulation, impaired stress tolerance, and disorganization feature very strongly. New slide. At the moment, the diagnosis is based on the core symptoms DSM-4. These include the 9 symptoms of inattention, new slide, and the 9 symptoms of hyperactivity and impulsivity. New slide. As the child becomes an adult, there is a change with how these symptoms present. This makes the diagnosis in adults more challenging. One sees an internalization of symptoms, therefore there will be less hyperactivity and impulsivity. The adult on the whole has more control over their behavior, with a persistence of ADD type symptoms. Often emotion regulation and anger become more prominent, and this can lead to a different diagnosis and a real difficulty in identifying ADHD accurately. It's also important to realize that people's lives become more difficult and challenging, and a lot of the symptoms are situation specific. New slides. An important area to highlight is executive function. People with ADHD have a lot of difficulties with timekeeping, sleep problems, and other organizational problems, and also emotion regulation. control of emotions and agitation is hard, and people may end up with a diagnosis of bipolar affective disorder because of the mood fluctuations. In fact, these are frontal lobe dysfunctions or executive dysfunctions. Newsline. The outcomes in ADHD are poor despite treatment. The main outcome of stimulant treatment may be on reduced prevalence of substance misuse disorders. But generally, people with ADHD struggle into adulthood. And the aim of the diagnosis and treatment is to try and manage this as best as possible. Newsline. I would like to discuss the comorbidities in adults with ADHD. It's important to realize that people with ADHD often have other neurodevelopmental disorders like autistic spectrum disorders or autistic traits, tics, and specific learning disabilities. These are things like dyslexia and other learning difficulties. Newsline. There are comorbidities that present first in childhood, although a previous slide has highlighted how that trajectory happens through childhood. So these are things like personality disorder, particularly dissocial personality disorders, but also significant mood disorders. And I have seen many patients who are diagnosed with a bipolar affective disorder when in fact they have adult ADHD. Anxiety is a very significant symptom in all these patients and causes a lot of problems with substance misuse, particularly alcohol. Sleep is a very significant difficulty for people with ADHD all through their life, and it's often one of the early symptoms in infants. These sleep disorders can be very difficult to manage, and it is the problem of people not being able to switch off their mind that keeps them awake. New slide. When people get referred to the adult ADHD clinic, they will be sent out screening forms, and when they attend the clinic, preferably with a loved one or somebody that they know from childhood, like a parent. A full psychiatric history is done, including a diagnostic interview for ADHD in adults called DIVA, a mental state examination, and of course developmental history. ADHD is a highly inheritable condition, and therefore family history is very important. The social and psychological factors are very illustrative to the severity of the condition and will help think about how to manage this as best as possible. The physical health is important, particularly with the view to future treatment. There are not many further investigations that need to be done, but if people have specific physical health problems, then things may need to be checked, like ECG. Hopefully a diagnosis can be made after the first appointment. New slide. So we stop.